For more information, visit lcdcexamreview.com. Hello everyone, and thank you for joining me in this presentation. I will be talking about practice domain number 7, documentation. In this presentation, I will address the definition of documentation and the knowledge, skills, and attitudes for this practice domain. Documentation involves the recording of the screening results and intake process, the assessment data, treatment plan, clinical reports, clinical progress notes, discharge summaries, and other client-related data. The knowledge, skills, and attitudes for this practice domain include to demonstrate knowledge of accepted principles for client record management, which means we need to know and be familiar with the regulations pertaining to client records, the essential components of client records, including release forms, assessments, treatment plans, progress notes, and discharge summaries and plans. We must know how to compose timely, clear, complete, and concise records that comply with regulations. Our documentation must contain information in an objective manner. We must write legibly if we take any handwritten notes, and we must be familiar with new technologies to record clients' information and to keep this documentation. The next KSA is to protect client rights to privacy and confidentiality in the preparation and handling of records, especially in the relation to the communication of client information with third parties. Our knowledge and skills in this area are knowledge of federal, state, and program confidentiality rules and regulations, confidentiality rules and regulations regarding to infectious diseases, the legal nature of records, request, prepare, and complete release of information when appropriate, protect and communicate clients' rights, explain regulations to clients and third parties, provide security for clinical records, willingness to seek and accept supervision regarding confidentiality rules and regulations, and the commitment to professionalism. The next one is to prepare accurate and concise screening, intake, and assessment reports, which include psychoactive substance use and abuse history, physical health, psychological, social, and spiritual information, history of criminality, educational and vocational information, legal information, and sexual information. The fourth KSA is to record treatment and continuing care plans that are consistent with agency standards and comply with applicable administrative rules. So we need to know the current federal, state, local, and program regulations and the regulations regarding informed consent. The next KSA is to record progress of client in relation to treatment goals and objectives. So we must know how to write and update our records. And this includes to prepare clear and legible documents, to document changes in the treatment plan, client status, client response to and outcome of interventions, level of care provided, and discharge status. Use of appropriate clinical terminology and standardized abbreviations. Note client's strengths and limitations in achieving treatment goals. Record client's response to and outcome of interventions. Record changes in client's status, behavior, and level of functioning. Note limitations of treatment provided to client. The next KSA is to prepare accurate and concise discharge summaries. The components of a discharge summary include client profile and demographics, presenting symptoms, diagnoses, selected interventions, critical incidents, progress toward treatment goals, outcome, continuing care plan, prognosis, and recommendations. Thank you very much for watching. Don't forget to subscribe, and you can follow me on Facebook, Google, and subscribe to the YouTube channel. And you can visit my website at lcdcexamreview.com. For more information, visit the description box, leave me a comment or a question, and thank you.